Hi there, my name's Kathryn. I'm one of the pelvic health physios at Women's and Men's Health Physiotherapy. One of the questions we often get asked by our pregnant and postnatal patients is when is it safe to return to high impact exercise like running and also weight training after having a baby. So I thought I'd share with you today some tips and some things that you can look out for to know that you're safe to increase your level of exercise after having your baby. I thought the best place to start when answering this question is to talk a bit about the anatomy of the pelvis and the effect of the pregnancy on the pelvis and the pelvic floor. So I have in front of me a pelvis. Here is your pubic bone, which sits at the front, and your tailbone towards the back. So deep inside your pelvis sits your bladder, your uterus, and your bowel. And if you imagine that we've taken out those organs, we're left with this group of muscles here, which is called your pelvic floor. There's two layers of your pelvic floor. This is the layer that sits a little bit deeper on the inside, and this layer here. You've got your urethra here, which is the tube that you wee through, your vagina, and your anus or your back passage. So your pelvic floor muscles actually extend all the way from your pubic bone at the front to your tailbone at the back, and each sit bone to sit bone, and they play a huge role of support and control around that part of your pelvis and everything that's sitting on top of it as well. So if you imagine your pelvis a little bit like a trampoline, it helps us to understand the effect of the pregnancy on the pelvis and the pelvic floor. Picture the mat of the trampoline as your pelvic floor muscles. The mat is connected by springs, which is all your connective tissue and ligaments, and they're connected to the rim of the trampoline, which is the bones of your pelvis. So when you're pregnant, we add weight on top of the mat of the trampoline. So there's increased weight that you might have put on during your pregnancy, obviously the weight of the baby, increased breast size, increased blood that's circulating through your body. So all of that extra weight adds pressure and load to the mat of the trampoline, which can cause some weakening and stretching of not only the mat but also of the springs of the trampoline as well. So we know that it's really important to look after your pelvic floor during your pregnancy and after having your baby. And this is also really important even if you do have a cesarean, as we know that it is the effect of the pregnancy itself that puts the most amount of pressure and stretch on the pelvic floor, regardless of the type of delivery that you've had. There is really good evidence to show that doing pelvic floor exercises during and after pregnancy is highly advisable and can help to prevent things like bladder and bowel leakage and prolapse after having your baby. There is also excellent evidence to show that it's advisable to get your pelvic floor muscles assessed by a pelvic health physio to ensure that you're doing these exercises correctly and that your exercise program is appropriate for your level of strength as well. So if you would like some extra help, please get in touch with one of our pelvic health physios and we can start you on the right track with your exercise program. So regardless of whether you've had a cesarean or a vaginal birth, the advice that we're now going to talk about returning to exercise is appropriate for both of you. So in terms of returning to exercise, we recommend starting with low impact exercise. Things like walking is the best place to start. Start slowly, and just a good guideline to keep an eye on is that you should be able to comfortably hold a conversation and exercise at the same time. At around the 3-month mark, then that's an appropriate time frame for you to start to look at increasing your level of exercise. So the guidelines do state that we recommend waiting until 3 months after having your baby before you start to increase your level of exercise. At that point in time, you should be able to comfortably walk for at least 30 minutes without any feeling of leakage from your bladder or bowel, any feeling of heaviness or discomfort around your vagina, your lower back or your pelvic area. There should also be no leakage from your bladder or bowel or feeling of heaviness or discomfort around the vagina with your day-to-day activities as well. If you've experienced any vaginal bleeding that's not related to your menstrual cycle, we do also recommend that you get this assessed by your GP or your doctor prior to increasing your level of exercise. So at this point in time, some further tips to know that you're safe to start to increase your load, so things like running or weight training, is that you should be able to jog on the spot comfortably for 1 minute with, again, no signs of leakage from your bladder or bowel or any feeling of heaviness or pain around the lower pelvis, vaginal area or lower back. You should be able to hop at least 10 times on each leg and be able to jump up and down, forwards and backwards, again with none of those symptoms. At that point in time, we recommend starting to gradually increase your level of exercise. So if it's running that you're looking to start to introduce, start slowly. A walking jogging program is often a great way to start, where you start by going for a walk and gradually increase increments of running into your walking program. And you gradually increase the amount of running time and reduce the amount of walking time over a period of weeks and months. Something like the Couch to 5K program is a good place to start. With weight training, again, start slowly and gradually and incrementally increase your weights over a period of time. Consider what your fitness was like prior to falling pregnant and also what your level of exercise was during your pregnancy as well, and be gentle and reasonable about your expectations about increasing your exercise. If you've also put on a degree of weight during your pregnancy and haven't lost this after having your baby, again, err on the side of caution and be conscious of the amount of extra load that this also places on your pelvic floor as well. If you've been diagnosed or are unsure of having a stomach separation, we highly encourage getting this assessed by a pelvic health physiotherapist prior to increasing your level of exercise, just to make sure that your level of exercise is appropriate and safe for you. If you're breastfeeding, consider wearing a good fitting bra, and it can be a good idea to feed your baby prior to exercising purely for comfort as well. Consider also that you're often sitting feeding a lot more than you're used to. There's a lot more lifting going on through your day as well. Plus, often you're sleep deprived and can be mentally and physically exhausted about dealing with a newborn as well. So be kind to yourself and have reasonable and realistic expectations of your return to exercise as well. There are so many health benefits from exercise, and we highly encourage women to get back into exercising after having your baby, but we just want you to do it in a safe and pelvic floor friendly way as well. If you would like some further advice and some guidelines on how we can individualise an exercise program suitable for you, please feel free to get in touch with one of our pelvic health physios and we can write an exercise program for you. I hope you found this information helpful, and we look forward to seeing you out and exercising as soon as you feel comfortable after having your baby.